Hello everyone. I hope that you all are doing fine and enjoying the Melbourne's cold weather. Last night there was a minor earthquake, right? Like around the midnight. Okay. All right. So we need to start from this topic here, which is the bleeding disorders. So, if your patient has any kind of bleeding disorders, either it could be acquired or congenital ones, include hemophilia, von Willebrand's disease, or other factor deficiencies, and thrombocytopenia. Some systemic conditions interfere with hemostasis, such as kidney, liver, and bone marrow disorders. So, patients with bleeding disorders should be managed in a specialist setting with appropriate consultation with the patient specialist or multidisciplinary teams. So the summary here is if your patient has hemophilia, von Willebrand disease, or any other deficiencies and thrombocytopenia, then you won't be treating that patient. And his treatment would be done by the specialist in the specialist setting, because if there any emergency occur, they would be in a better place to manage it. Then bone and metabolic disorder. So if your patient has osteoporosis, we read in previous pages that he would be taking the anti-resorptive drugs, and we need to do the management accordingly. Then adrenal disorders. Patients with adrenocortical suppression or adrenal insufficiency are at risk of glucocorticoid deficiency during periods of physiological stress. So this is what we read under the corticosteroid topic. So during the period of physiological stress, there is deficiency of this hormone in the patient's body, and this could lead to very emergency condition which is called as adrenal insufficiency or adrenal crisis. Then thyroid disorder. So if your patient has any thyroid disorder, patient with a stable medication controlled thyroid disorder, so if the patient has either hypothyroidism or hyperthyroidism but it is under control with the medication, do not usually have any difficulties with dental treatment, then we can perform the normal dental treatment in those patients. Although adrenaline containing LA solutions are contraindicated in patients with unstable hyperthyroidism, they can be safely used in patients with stable thyroid disorder. So if the patient has thyroid disorder, like either it is hypo or hyper, it doesn't matter, we can treat him in the general operatory, but the thing is it should be stable. But if it is unstable, then you cannot even give him the LA, which is contraindicated, the local adrenaline containing LA solution. And first we need to stabilize his thyroid level, then only we should perform the treatment. Defer dental treatment in patients known to have an unstable thyroid disorder. So if you know that his thyroid level is not stable, then first our main importance is to make that level stable and then only proceed with the treatment. Then cancer. Dentists have an important role in the initial recognition and diagnosis of oral cancer. If a patient who has had head and neck cancer treatment has a suspicious oral lesion, refer for investigation to exclude cancer recurrence or a new primary cancer. So whenever you are suspicious, although they in Australia they do say to the dentist like to be more suspicious, whenever you see like any of those red flag features or anything which you find out is unusual, then you should be very suspicious and you should refer as soon as possible for the investigation to exclude cancer recurrence or any new primary cancer. Metastatic cancers to the oral soft tissues and jaw bones, they commonly originate from primary malignancies in the breast, prostate, kidneys, and lungs. Okay, so primary sites are these four sites in the body, and secondarily, through the metastasis, they cause the cancer in the mouth. Leukemias and lymphomas may also present in the oral cavity. And for further information, as we read in oral mucosal lesion topic. Then chemotherapy, because these cancer patient either they would be taking the chemotherapy or they would be taking the radiotherapy for the treatment. So how we need to change our management accordingly? Ideally, patients should be dentally fit before starting chemotherapy. So, as we read in Ron's topic, that before starting any anti-cancer drug, which are the like either anti-resorptive or anti-angiogenic drugs, it is a good recommendation that we need to make patient dentally fit, particularly if the chemotherapy used can cause severe mucositis and reduced salivary flow, which means the dry mouth. For the management of these complications, we have already read how to manage the mucositis and the dry mouth in the oral mucosal lesion topic. You can go through that again so that it will, stick with you. Then some types of chemotherapy cause immune suppression and increase the risk of oral infections such as oral candidiasis, herpes simplex virus. So because these chemotherapy helps the patient to fight the cancer, but as a side effect they do lower down our immune level, and that's the time when the opportunistic infection can get more activated, and they are very much more prone to getting more infections as compared to the normal public. Develop dental treatment plans in consultation with the patient's treating specialist or the multidisciplinary team. Some types of chemotherapy cause significant neutropenia and thrombocytopenia, particularly the treatments for leukemia and lymphomas. So, before undergoing or before making any treatment plan for them, you need to consult with their specialist. Patients with neutropenia or thrombocytopenia require specialist management for dental treatment. Perform dental procedures when the neutrophil and platelet counts are adequate. Seek expert advice for emergency dental procedure. Tooth extraction sockets heal well in most patients undergoing chemotherapy. However, patient taking anti-resorptive or anti-angiogenic drugs, there is a risk of MRONCH. So in that case, you need to seek specialist advice. Then head and neck radiotherapy. Patient who require head and neck radiotherapy should be reviewed by a dentist experienced in cancer management as part of multidisciplinary team. Radiotherapy can cause oral pain, mucositis, reduced salivary flow, oral infection, trismus, and altered taste. Reduced salivary flow can increase the risk of periodontal disease and dental caries. Good oral hygiene can reduce the incidence, severity, and duration of adverse effects associated with radiotherapy. So for the radiotherapy, there is one Odell case that you can read with this topic. In that case, the patient has had the radiotherapy treatment, and afterwards, due to the low salivary flow and due to the all other mucositis and all the other issues, he has got a lot of caries in his teeth. So you can read that topic together, but radiotherapy can lead to these type of harms. So how we can help patient to prevent that by advising him to maintain the good oral hygiene. Ensure optimal oral health if possible. Any necessary dental treatment should be completed before starting radiotherapy. If extractions are performed, then you need to allow adequate time for wound healing, which should be usually 10 days to 3 weeks before starting radiotherapy. Okay, if possible. Then patients who have had head and neck radiotherapy are at increased risk of osteoradionecrosis. So the patient who are taking the chemotherapy, they are at the increased risk of MRONJ, medication related necrosis of the jaw, and the radiation patient has the risk of osteoradionecrosis. Encourage regular dental review and seek advice from the patient's multidisciplinary team before performing tooth extractions that are within the field of radiotherapy. If possible, choose conservative dental treatment options, example periodontal treatment, restorations, endodontic treatments, root canal or fluoride applications. So you can do these conservative treatments so that patient we can avoid more invasive treatments. Okay, and the neutral fluoride products are better tolerated than acidulated products in these patients. Management of osteoradionecrosis is difficult and it requires specialist management. So, as soon as you find out that the patient has osteoradionecrosis, you need to refer him to the specialist. And same for the MRONJ. Whenever you find out that the wound is not healing and it's been more than 8 weeks now, then refer to the specialist. You cannot do anything when these complications occur. Do not extract teeth from a patient who has had head and neck radiotherapy without consulting with their patient's multidisciplinary team. So, for the cancer patient, whether they are taking the chemotherapy or the radiotherapy, because they have a lot of side effects. So, first you need to consult with their specialist or with their whoever is managing them. Then you can perform the invasive treatment. And the most important thing in these patients is that they should be dentally fit, and advise them to maintain the proper oral hygiene. That would help in reducing the incidence and severity of any infection or any problem that they could happen. Then cardiovascular condition, which first we are going to read if the patient has any blood pressure problem like the hypertension. Patients treated for elevated blood pressure can undergo general dental treatment if their blood pressure is under control and stable. Although LA containing adrenaline, theoretically it can lead to increased blood pressure, they do not have a clinically significant effect. But in patient who has high blood pressure, you can give them the normal LA, but you need to avoid NSAIDs. Okay, in patients taking a diuretics plus an angiotensin converting enzyme inhibitor, which is the perindopril, or an angiotensin 2 receptor blocker, example candesartan. Combining these three drugs classes can cause kidney failure. So the summary is you should avoid giving, because these ACE inhibitors or angiotensin 2 receptor blocker, these you won't be giving these to the patient, right? So these should be done, these should be prescribed to him by his specialist. But what you can prescribe here is the painkiller, which is the NSAID. So it is the point to remember that do not prescribe the patient NSAID who has hypertension. Alternate analgesia, example paracetamol, are recommended. Then calcium channel blockers, which is the amlodipine, can cause gingival enlargement. So there are certain type or certain categories of drugs that people take to lower down their blood pressure. So if the patient is taking calcium channel blockers, so they have the side effect of causing the gingival enlargement or gingival hyperplasia. Gingival enlargement can be minimized with good oral hygiene. However, extensive gingival hyperplasia requires specialist management. Coronary ischemic syndrome. It means in dental practice, first aid management of angina or an acute coronary syndrome is outlined. We will read about this first aid management, what you need to do if your patient has any attack of angina in the dental clinic. or acute coronary syndrome in the later medical emergency topic. But here we will read the overall summary. Okay, so check if the patient is taking antithrombotic drugs, because these heart patients should be taking the antithrombotic drug to prevent the formation of thrombus in that area. So for the antithrombotic drug, we read in detail a few days back, like what you need to do if the patient is taking anticoagulants, or what you need to do if the patient is only taking the antiplatelet or the combining therapy, what modification you need to do. So you can just revise that topic again with this topic. In the 12 months after MI, stent placement, or coronary artery bypass surgery, patients are at increased risk of major adverse cardiac events. So even after the 12 months, they are at higher risk. Defer elective dental treatment for 6 months after MI, stent placement, or coronary artery bypass. Elective treatment would be like the fillings or the scaling and cleaning. So you cannot do those treatment before 6 months. If dental pain or infection occurs within the 6-month period following the event, then you need to provide adequate emergency treatment in order to defer definitive treatment and consider seeking specialist advice. Okay, so here they have said that these patients, MI or stent placement or bypass surgery patient, they are at risk of this thromboembolic event even after 12 months of their surgery. Okay, so ideally they recommend that until 6 months you should not plan any elective treatment on them. But if there is any emergency, then you need to seek specialist advice and provide them the emergency treatment in order to defer the definitive treatment. Patients with a history of coronary ischemic syndrome can undergo dental treatment as long as their condition is stable and they are following their preventive or rehabilitation program. So, until and unless if the patient has any condition, right? But if it is stable, then we can treat it like a normal patient. But if that condition or that disease is not stable, then we cannot really treat that patient in the dental clinic. The presence of a pre-existing coronary stent is not an indication for surgical antibiotic prophylaxis for dental procedures, and instruct patients with angina. So if your patient has angina attack history, then you need to advise him to bring their medication, which would be the glyceryl trinitrate spray or tablet, when attending for dental treatment, and have it in a readily accessible place. Limit the duration of dental procedures. Use relaxation techniques and consider anxiolysis to relieve their stress. Okay, because we do not want to put them into stress that can initiate their angina attack or their coronary ischemic syndrome events. Ensure effective analgesia during dental procedure using a local anesthetic. The use of a vasoconstrictor with LA is not contraindicated in these patients. So you can safely use the normal LA in these patients. Then the patient with heart failure, do not undertake any dental treatment unless the patient is stable. So it is for this line is for every disease. Like until the patient is stable, you should not plan any dental treatment on that patient. And also try to limit the duration of the dental procedure as quickly as you can. And patients with heart failure may not tolerate being placed in a horizontal position. Okay, then what would be the best position for them? Position the dental chair so the head is higher than the heart at a similar angle to how their patient would can comfortably sleep. Okay, so their head should be higher than the heart. They should not be laid on the horizontal plane position. They should be like for example, like horizontal position means if the patient is lying on the bed without a pillow. But if he is using the pillow, that means that his head is higher than the heart. So that is the comfortable position for him in the dental chair. Patients with severe heart failures are at increased risk of adverse outcomes from sedation and general anesthesia, and dental procedures require sedation or general anesthesia should be undertaken in an hospital. Anyways, you won't be doing, as a general dentist, you won't be doing these general anesthesia or a sedation events, so you should not be bothered about these. But for the NSAID in patient with heart failure, you need to avoid it. So, in which patient we need to avoid NSAID until that we read till here is the heart failure patient and the hypertensive patients. Then cardiac implanted electronic device. If any patient has any electronic device which is implanted, for example, implantable cardioverter defibrillator or permanent pacemakers, those patients with can undergo most general dental treatment. Surgical diathermy can interfere with some cardiac implanted electronic devices, but with modern devices, interference from most other dental electronics and ultrasonic devices is usually not clinically significant. Because previously, if the patient has any type of these ultrasonic devices, we were very cautious to use the ultrasonic scalers, but now they said that their modern devices does not really interfere with the scalers and you can do the normal dental treatment. However, if you are in doubt, then you need to consult their cardiologist. So this is the, this is a norm in Australia, or according to this book. Like whenever you are in doubt, do not just treat the patient in a situation just in case or let's try this. You should be 100% sure. If you are in doubt, there is no shame in asking for help. There is no shame if you do not know anything, but for the patient comes first. You should not be doing anything wrong to the patient. Okay, and seek expert advice before a dental procedure. The presence of this device is not a specific indication for a surgical antibiotic prophylaxis. So, even if the patient has pre existing coronary stent or the electronic devices, there is no need to prescribe antibiotics before the procedure. Cardiac implanted electronic devices should not be confused with prosthetic cardiac valves. The presence of cardiac implanted electronic devices is not a specific indication, because for if the patient has any prosthesis in their heart or prosthetic cardiac valve, then we need to prescribe them antibiotic for the prevention of endocarditis, infective endocarditis, right? But these electronic devices are different from those prosthetic cardiac valves, so you should not be confused about that, and there is no need to prescribe either the surgical antibiotic prophylaxis or the antibiotic prophylaxis for infective endocarditis. So we will end the today's video here, and tomorrow hopefully we will start with the diabetes topic. And you all know that diabetes is very common in Australian population, and it is even more it is prevalent, and its prevalence is more and more increasing day by day, and there is so many other disease that can happen to the patient if he is diabetes. And so you need to be very thorough with this topic, and according to the exam point of view, there would be a lot of scenarios in which the patient would be diabetic or he would be smoking. So you need to uh, and make your mind like that. Okay, thank you so much, guys, for watching my videos. And I would really appreciate if you can also subscribe to my channel and like and share with your friends or like anyone. All right, thank you.